got diagnosed, I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kong aparador, mukha na daw kong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jansen and Sir Shyan. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusing mom, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. First of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos, kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh, kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPARs, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also, and I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer, and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, falls apart, sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, ang sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So, I just ordered 6. 6 ngayong May. So, that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So, I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
And we are live! Health Today, everyone! My name is Jenny Macanjola, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. Last week, Thursday, we discussed how endometrial cancer can sometimes begin with abnormal or unusual bleeding that is often mistaken as normal, allowing the condition to progress while placing stress on the body's immune balance and inflammatory response. Tonight's topic is something many people are uncomfortable talking about, yet it may quietly save someone's life. Because sometimes the body whispers before it screams. And one of the most ignored warnings in the human body is blood in the stool. Many dismiss it as hemorrhoids, others blame stress or spicy food or constipation or lack of sleep. But what if? What if that small streak of blood is actually your colon asking for help? What if the body has already been inflamed for years silently before symptoms appeared? So tonight's session is entitled Colon Cancer When Blood in Your Stool Becomes a Warning You Should Never Ignore. And this discussion is especially important because colon cancer is no longer affecting only the elderly. We are now seeing younger adults in their 30s and 40s developing aggressive colorectal disease, often detected late because the symptoms were ignored too long. So that's heartbreaking. Your colon is not just a waste pipe. It's actually one of the body's most immunologically active environments. Nearly 70% of immune activity is connected to the gut environment. Inside your colon, there's trillions of bacteria interacting with your immune system. There's inflammatory signals constantly communicating with cells, and damaged cells are supposed to be repaired or removed. So, when inflammation becomes chronic, the environment changes. Cells may begin mutating, multiplying abnormally, and resisting normal death signals and surviving longer than they should. So this process can happen silently for years before diagnosis. And one major driver scientists continue studying is chronic inflammatory signaling. This now brings us to something very fascinating in modern integrative science. PPAR signaling pathways. PPAR stands for peroxisome proliferator activated receptors. These are regulatory pathways found inside our cells. So think of them as cellular communication switch involved in inflammation control, metabolic balance, immune modulation, oxidative stress response, and cellular resilience. PPAR pathways influence inflammatory conditions, metabolic disorders, and even environments linked to abnormal cell behavior. But what makes this important for gut health? Because the colon is highly sensitive to inflammatory imbalance. When inflammation remains uncontrolled for years, imagine this, tissues become stressed and then repair mechanisms weaken, so oxidative damage accumulates and the intestinal environment becomes less stable. Now, let's be very clear. This is not presented as cure for colon cancer, and patients should never delay proper medical diagnosis, colonoscopy, or surgery, chemotherapy, or physician-guided treatment. However, many individuals today are searching for ways to better support their body's internal environment during health challenges because people are beginning to realize health is not only about attacking disease, it's also about strengthening the body's resilience. Let me ask everyone tonight. How many of you know someone who ignored symptoms because they were too busy? Type yes in the comments if you know someone. Kayo Sometimes the problem is not lack of symptoms. Sometimes the problem is delayed action. So please never ignore these symptoms. Number 1, blood in the stool. Or number 2, black stool, persistent bloating, and a pencil-thin stool, yan, unexplained fatigue, sudden weight loss, chronic constipation alternating with diarrhea, also abdominal pain after meals, and iron deficiency anemia. Especially if symptoms persist beyond 2 to 3 weeks. And if you are above 45 years old. So routine colon screening becomes extremely important even without symptoms because early stage colon cancer is often highly treatable, man. At this point, we'll move into our interactive Q&A portion, and this is usually where many hidden concerns finally come out because sometimes people are too embarrassed to ask these questions publicly. But remember, awareness is protection. So now, to help us go deeper into this topic and truly understand how to apply this in real-life recovery, first we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARs expert from Singapore, Mr. Shyan Lim. And joining him is Dr. Jansen, a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening po.
Good evening. Good evening,
Hello.
Doc Johnson. Good evening, Jen.
Good evening.
Doc,
Good evening.
I'll be seeing you in 2 days.
Yes,
in
yes. See you on
person.
Saturday.
Yeah. All right. So Jen, let's start.
Okay, there are some questions that wasn't asked last webinar. These are the follow-up questions. Okay. Apart from cancer, what could be the other reason why there is blood in the stool? Coming from Alex.
You can have a bulky stool. Okay, so the bulkiness of the stool can stretch the anal sphincter and it can bleed. Okay, so that's one. Another one is if you have a hemorrhoid and it bleeds. So yeah, those are about the two. Another one. Which is more gory, but the third one can be a worm, an intestinal parasite. So you can also have blood in your stool from those.
Yeah, so I think this question
Okay.
comes from a person who is probably afraid. Doc, I think very sensitive. Doc, I also had something similar. There was a time I started urinating. My urine was red in color, like blood. Not as as red as blood, but there was like blood in the urine. Oh, I was so scared, for guys, this like, oh, something's wrong. And then I actually went to the specialist, the urologist and everything. It turned out it's because I exercised too hard. At the time I was trying to lose weight. So I was running 3 times a day. And that stress actually caused bleeding. So to this particular viewer, I'm sure when you ask this question, you are afraid something bad is happening. So don't scare yourself too much. So Doc, what should a person do if they find that they are bleeding from the stool and like me, they want to know for sure, they don't want to ignore it and it turns out to be something serious. So who should they go and see first? Is a family physician enough?
Okay, it depends on what country you're gonna. It depends on what country you're in. Depends on your financial capacity. Depends on the healthcare system that you are in. Okay,
Okay, but let's say you're in Philippines.
Here in the Philippines, yeah. If you're here in the Philippines, it's easy because the doctors here are quite accessible. So if you have money, you can just go walk in or set an appointment with any gastroenterologist or surgeon.
Gastroenterologist. Okay.
Yeah, gastroenterologist or general surgery. Both will do okay. Now, if you are someone if you have insurance, for example, or if you have, let's say, for example, you are enrolled in the National Health Insurance, which is PhilHealth, you can go in to a family medicine clinic who is registered with PhilHealth's programs. Then you don't have to pay anything. Then you can see your doctor already. So family physicians, general, so GPs, doctors who are in general practice, those are more than capable in handling these cases wherein you have blood in your stool. But of course, you have to investigate this systematically, find out the diagnosis first, get a proper diagnosis before you assume treatment. Okay, it should not be the other way around where treatment is always the priority. Okay, but I understand that you prioritize, you want to get well soon, but it doesn't work that way. Okay, or else you're going to be shooting darts with your eyes closed. Okay, so better get someone capable in investigating this one. So you can go through the healthcare system. So you can talk to a GP or family medicine doctor first, or perhaps an internal medicine physician. Then if you want to go straight to specialists, that would be your surgeon or your gastroenterologists.
Okay, so at least we know. If you want to see a specialist, the correct specialist for this case would be gastroenterologist or a general surgeon. If not, start with the family medicine. I mean, doc, for Singapore, we will actually start with family medicine because of our social security, Medicare. If you go straight to the specialist, then you pay everything. If you want the government to subsidize you, you go through the system. That means you see a family physician first. And when the family physician recommends you to a specialist in the, let's say, Singapore General Hospital, which is like PGH, then the treatment will be so-called free of charge, paid by the government or subsidized.
Right.
Is this the same here in Philippines as well?
Yeah, we have
yeah,
something similar.
something like
but
that. Yeah,
something like that.
something similar. Okay, that's good.
Something similar, but I mean, the reason why I said it's something similar because of funding issues, political
I understand.
behind this
You don't
system.
have to say more.
I mean, everybody who's watching us who are Filipinos would know.
Yes, yeah. It's quite frustrating. I think even as for myself as Filipino, I mean, this is my adopted country. It is frustrating to know that so much money has been allocated by the federal government, but yet the money never reached the people, right? So that's the frustration.
You're a taxpayer. You're a huge taxpayer here. I mean,
yeah, correct, right? And yeah, sayang. I really learned, this year, it's not that the Philippines is poor. Actually, the Philippines is a very rich country with lots of taxes. Yeah. Let's go to medical questions. Jen.
Okay, next question coming from Maricel Reyes. I have myoma for 13 years. My OB-GYN said it's benign, but she also said I look like I'm pregnant for 6 months already. So what's your advice for me?
Well, if it's not causing any problem, you don't have abdominal pain, you just look like you're pregnant, you're not bleeding, then that's fine. You don't just leave it alone. There's no indication to do surgery at this point.
But doc, I mean, if
probably you can try PPARs.
Yeah, okay, that's right. I was about to ask,
you can try.
Even though it's benign, right? I don't think anybody will feel normal. I mean, even if it's a guy, right? If your stomach is bloated beyond a visit to Vikings, right? So if you actually look 6 months pregnant and it's benign, I'm sure it will. I'm sure it will freak you out, as a lady as well, right? That this is not normal. But doc, you're saying that medically speaking, there is no urgent reason to go for, say, surgery because it's benign.
Yes. Yeah.
Okay.
So in a way, you're in a situation where you're in limbo.
You're in control.
You're in control. But of course, the only treatments for conventional medicine for you don't need them as of the moment. But of course, there's always this something in your body that that's something's not right, something's different in your body. So this is the point wherein you can explore different treatments.
Yeah.
You can explore perhaps the first thing that you have to explore would be detoxifying, because the myomas, the reason why myomas are there is because of too much estrogen exposure. So that's why they grow. So you might want to consider cutting off excess exposures to estrogen. So what are those? That would be your personal care products. So there are a lot of endocrine disruptors that we call that mimics the effect of estrogen. So this thing you cut out. I mean, dairy products has estrogen. Canned goods like with BPA. The cans use BPA. So try to avoid these canned goods. What else? Anything with fragrance or phthalates, so that you also exclude that from your personal care items. Watch out for parabens, because paraben is an endocrine disruptor as well. So those things, you do away with them. You can go for procedures that encourages detoxification, like IV chelation therapy, infrared sauna to make you sweat. You hydrate, increase your fiber intakes, you poop better, fix your gut, in other words. So those things you can do. At least you remove the exposure the too much, the excessive exposure of your body to estrogen, then with this, sometimes you can see healing. Yeah, you can expect healing, but of course, if the myoma is huge, then don't expect it just to shrink or magically disappear someday, right? There would be a point wherein it doesn't shrink anymore because it grew to a very large size. But at least, there's the hope of it reducing in size. Yeah, so one product that you can also consider would be this one, Simply Nature PPARs, because it's made from algae. Algae are chelators.
So
Yeah.
as Dr. Jansen said, medically, so the good news is medically, you are not in the position where you have to be sleepless or that you have to go for surgery, which a lot of our viewers try to avoid surgery, right? So medically, you're in control because you can control what you want to do. There's nothing pressing you. But as we all know, I'm sure you feel very very, very frustrated. Why do you look like you're 3 months or 6 months pregnant? So obviously, it's not normal, right? Even if it's not a medically threatening, this is not, somewhere in the back of your head, this is not a good thing, right? So I think this is a perfect example of going for natural therapies, including getting your lifestyle back in order. And PPARs is really just very good for any abnormal growths, all right? Because it works on a very basic level, very fundamental level. Deals with inflammation, your metabolic pathways, your immune response, things like your macrophage cells and things. All that could be a solution, right? So no harm. We've actually had many clients and patients. So one of the top endocrinologists in Philippines actually swears by Simply Nature PPAR soft gel capsules for what's that called? Oh no, what's that? For women's when they have it's slipping my mind. I just arrived in Philippines from a flight, so my brain is still in the air. Okay. PCOS, yeah, for PCOS, right? For PCOS, he swears by it that just soft gels will actually solve the PCOS issues, right? So you can try. It's totally it will benefit you metabolically as well. So blood sugar, blood cholesterol, all these will improve. It'll keep you anti-cancer because if you have any growth in your body, you're always afraid that somehow it will morph into cancer. So if you manage your metabolic syndromes and your general inflammation, you'll be very anti-cancer. So yeah, we will recommend that for you. If finance is not an issue, right? If money is not an issue, I would actually recommend trying the PPAR powder, right? Because if you have a growth and if you finish one jar of powder, which will last about anywhere between 2.5 weeks to 4 weeks, 1 month, then you can see if there's any change in the size, right? And since your stomach is so big, you could probably physically know whether this is something that will work for you. If finance is a slight issue, then I would recommend the soft gel capsule, right? But that will just take a longer time. Give yourself like 3 months, right? Again, one thing is that the rest of your health will improve. So it is a win-win for this scenario. And take the opportunity to take the advice of Dr. Jansen, get your health in order, eat properly, avoid all these other things. And I'm sure because it's not a medically harmful condition that you're in, that you will get well.
Yeah.
Before we go to the next question, let me just greet Miss Caitlin Kamunayan watching from YouTube. Good evening po. Okay, next question. It's from a caregiver. It's from Mr. Eman Alcaraz Lumbab. Hello, Doc. I'm taking care of a lung cancer, stage 4 patient, 73 years old. Just diagnosed last month. She is a stroke patient, right-sided weakness, and then wheelchair bound but can still stand up for a while. Conscious communicative with interval of memory gap at times. Poor appetite, relies on Ensure, ready to drink. Yeah. Hypertensive, diabetic, and on regular maintenance medicine. So I'm asking, Doc, is there any chance for her? She's on palliative treatment only. Please, Doc, advise us about your care on this patient and your treatment plans. We are from Cebu City. Thanks and God bless.
Wow,
Okay, you're in
Doc.
Cebu. All right. So this is what we can do, no? Right now, so we have to set expectations first. So goals. So you have a patient to have lung cancer stage 4. So at this point, the primary goal is to maintain status quo. Okay? It's to prevent the cancer from growing. So how do you do that? You have to kill the circulating tumor cells and to help the immune system in killing the cancer cells. So there are a number of ways for you to do that. Number one is to reduce tumor burden, meaning you try to reduce the tumor size, hoping that some of the lesions disappear. So how do you do that? Conventional oncology treatment. So for lung cancer, you can consider chemotherapy or targeted therapy. So the targeted therapy would be oral medication. Okay, now for a patient who is elderly already, who suffered from stroke, chemotherapy might not, so there can be a lot of reservations on chemo. So you can explore targeted therapy then, but you need the guidance of a medical oncologist for this. And a biopsy might be required, all right? Because they need to investigate a mutation called the EGFR mutation. Because if that's positive, then you would be a candidate for the targeted therapy path. Now, if it's negative, then the option that the medical onco will give you would be chemo. Okay. Now, can we give some things to support the patient to finish the treatment? Yes. So that would be my area. So there are a lot of ways to support the patient. So we have to look at the patient holistically, so entirely, okay? A whole body approach. So now some considerations with my approach, okay, is I look at the metabolic health, I look at the immune function, and I try to give some supplements to the patient to help reduce treatment resistance to whatever the onco will give. All right? So that's the general approach. Okay? Actually, yeah, that's a general approach. Okay? Now, you can also further go one step further to do a liquid biopsy, because the liquid biopsy, this test will show us what natural extracts will kill the circulating tumor cells. So this is sort of like receiving a cheat sheet, a list of substances that will kill or not kill the circulating tumor cells. So now you eliminate or you reduce trial and error, because now you know the substances that will kill the circulating tumor cells. Okay. This test can also encompass the medications that the medical oncologist will give. So, because this test also tests for chemotherapy, immunotherapy, targeted therapy, which are the relevant medications for lung cancer. Okay. So that's how we can approach things. Yeah. Okay, that's how we can approach things.
My take is that coming purely from Simply Nature PPARs perspective, is I think this is it's an example where the patient has many issues and is at an age that is sensitive, and to the point that unless, so I would number one advise you to go for consult with Dr. Jansen, right? Because you really have to talk, because there are many factors going on, and then Dr. Jansen is very qualified in this from both personal experience and also as his an experience as a professional medical doctor as well. So is this at this age with all the other issues, I'm sure it's quite a lot of things to consider. Or do you want quality of life? Is it worth going for? How much money do you want to spend in total? That all these are important questions that are quite hard to just say like that. And I would totally understand it's not so straightforward and simple. So I want to encourage you, even for myself, right? It's not that I don't have the finances to support my father when he had a cancer scare. Okay, my father is a throat cancer survivor. So again, he had some polyps So there was a possibility that the cancer came back. So financially, because I'm not alone, I have two siblings and we're all doing well in life. So we can afford. But again, I'm not going to say that, wow, cancer treatment, which can cost all the way up to 30 million pesos in Singapore, right? Is something that it's not that it will not be stressful too. Okay. So it's a very real thing. So my father was about 70 years old when that happened. So I actually had to ask him, Dad, what do you want? Right? If you want to fight, then let us know as children. This is even before the cancer whether it was confirmed. Just suspected that there was a recurrence. Straight away, I asked my dad, I said, if you want to fight the cancer as your children, of course, we will do our best, but let us know so that we have to mentally prepare already, cancel all the vacations, uh, change our spending because we have to prepare the money, for him to fight. So my dad's answer to me is he just doesn't want to suffer, right? He said, don't need to spend all this money on him. He told me directly face to face, he said, my best days are behind me. So he's like saying, nothing that I really look forward to in life that I need to fight so hard. But what I don't want to do is I don't want to suffer lah. So that was what his answer was. So thankfully, in my father's case, the polyps turned to be benign and it actually disappeared after a while after taking Simply Nature PPARs, right? So for your case, this particular case, there's so many factors. First thing, if as a family, if you are willing to spend money, but you don't want to spend, you don't know how much you want to spend, right? So I think Simply Nature PPARs actually falls in that very nice category lah, right? It's money. If you take, for example, Simply Nature PPARs powder, right? Will it be the best thing? I would definitely recommend is the liquid, right? So maybe the liquid first and the powder. Is that money significant? I think it's significant enough to know that you're doing something. But it's not so much like you have to commit 3 million pesos, for example, when you go for or 1 million pesos, right, straight off, or 500,000 pesos straight off. So those are different types of commitment. So these are things that very difficult for everybody to weigh, and especially the patient is so old already and has other issues, and then just survive a stroke as well. So it's really not easy. So I can suggest that you start with either the Simply Nature PPAR liquid to see why the liquid and not the powder. I would just say the liquid so that you can see the response. The liquid is our strongest product. And even Dr. Jansen's patients, many patients, not only his, but our other doctors, within the first box of the liquid, they can see some improvement. And when I say improvement, I'm not saying that cancer disappear. I'm just saying that they're stronger, that they talk with more energy, right? They feel better, right? Or they have a better appetite, things like that, right? That makes it easy to consider, okay, next step, now that we see some hope, what do we want to do next? So that's another thing that you discuss as a family or as a caregiver as well, right? You want to, if not, it's hard to commit to something that requires so much commitment if you don't know how the patient's going to react. So this is something where it's neither very cheap, it's not, but it's also not so overwhelming that you can start with. So liquid, I would recommend liquid so that you can see how the patient will react to our product range. Or you can go with the powder because the powder will last longer, so that you can also, again, for the same reason, within one jar or one box of liquid, you can see whether this is the path that you want to take. And I think the amount of finances and money is manageable, right? It's not so scary and big that you cannot recover from it or you cannot change. The next one is that there is no downside. So I hear the patient has diabetes, blood cholesterol, recovering from a stroke. All these things are what Simply Nature PPARs powder and liquid is very good for. It's very beneficial for. So it's a win-win situation. And if the patient has more strength and looks recovering, I think it's easier for everybody involved in taking care of the patient to be more positive after that, and to aim for possible curative and not just palliative, right? I mean, want to do more than just palliative. But if the patient, so you can see how the patient reacts, that will help you decide your next stage lah. I'm speaking more from a point where I was the son of a person, or my father had a possible relapse. So honestly, it's easy to say what we want to do, but actually we have a plan, but we do take it one step at a time. So I hope this helps. Yeah.
And for those of you who wish to have a consult with Dr. Jansen Kalalan, you can schedule an appointment using the link in the description box and comment section below. Our caring healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. Speaking of thyroid, our next question is coming from Abonales Yam Claire. And I want to know more about conventional treatment after RAI. I was diagnosed of papillary thyroid carcinoma and already underwent RAI.
That's it.
That's it. That's it.
That's it. So for
What comes
thyroid,
next after
yeah, for thyroid
RAI?
cancer, conventional. So you're okay for when you use the semantics, no, conventional. This means that we are following a guideline used by majority of doctors who are handling thyroid tumors or thyroid cancer. Okay, so guidelines tells us that if you have a tumor on the thyroid and it is resectable, then you have to undergo total thyroidectomy, remove the entire thyroid, and then undergo RAI to eradicate the remnant, the remaining thyroid cancer cells or the remaining thyroid tissues. So it's essentially sterilizing you of your thyroid organ. Okay. So after you undergo RAI, there's nothing else to do then. Okay. So the only thing that you have to maintain on would be thyroid hormones like your levothyroxine, or perhaps there are available already the thyroid capsules. These are thyroid granules, okay, that you can take together with your levothyroxines. Okay? Then that's about it. That's the conventional path. Now, more than that, can you do some more or further testing? Yes, liquid biopsy, but the liquid biopsy will only show you at this point, okay, because you've finished RAI, the liquid biopsy will show you circulating tumor cells, okay, that might be still swimming or alive in your bloodstream. So the circulating tumor cells will tell you whether you need more supplements, more medications to help control or help eradicate those circulating tumor cells. Okay, but not necessarily a repeat RAI because radioactive iodine, you can only do this, I think, once or twice. Okay, some patients of mine have underwent 2 sessions of radioactive iodine in their lifetime. Okay, beyond this, I haven't heard of it. All right, but it's not a procedure that you can repeatedly do. So for recurrence prevention, what you want to do is to know what supplements. Okay? So that is where liquid biopsy comes in. And then of course, other aspects of your health, risk factors that might encourage cancer growth or cancer progression, those are some of the things that you have to look into, which is in my realm already. Yeah.
Doc, why is
That's what you do. That's basically what you do.
Doc, why is there a limitation
RAI.
for RAI?
Because it's a radioactive. You
So
cannot
it's
expose yourself to too much radiation.
okay. Oh wow. Okay. So it is that strong now.
RA is radioactive
Yeah.
iodine. Yes, yes.
Okay. So it is that strong that you can. Wow.
Mm-hmm. Yeah, that's what you do.
Yeah. Sorry, I was mute. Okay, before we move on to our next question, let me just also Miss Naomi Veras, watching from Bicol, Sorsogon City. I'm Bridget. Thank you for sharing. Okay. Next po. We have some AD Pro questions coming from Sir Dennis. Is AD Pro can be used for hemorrhoids?
What do you think? I'll tell you what AD Pro can be used for, right? AD Pro is used for anytime your skin breaks out in itchiness, redness. So surprisingly, of course, the first place that we use AD Pro for is for psoriasis, eczema, atopic dermatitis. But it can actually also be used for pimple breakouts. How AD Pro works is this. Every time your skin has a rash or reaction, right? Especially a breakout, that means there's something, the skin breaks, all right? So bacteria, right? There's a specific type of bacteria, Staphylococcus, which causes the redness and the inflammation, right? So how AD Pro works is that it reduces, you put the bacteria that suffocates this bacteria that causes the redness and the infection. By example in an aquarium, right? Let's say I think you have this in Philippines as well. Okay, here's a simple one. If you have a pond and then you're so afraid marron mosquitoes will grow in the pond, right? You put in guppies, diba? The guppies will eat up all the mosquito larvae so that your mosquitoes won't grow in your pond in your house, right? So that's the same way AD Pro works. You get the good bacteria that doesn't eat up the bad bacteria, but it will squeeze out. It will eat all the food so that the bad bacteria don't have food to eat. Something more, the mechanism is more like that. So anything to do with redness and inflammation, itchiness is always is caused by this bacteria. So what happens is that when your skin is itchy because of your immune response, right, it causes itch. So you will scratch the itch. When you scratch the itch, you break the skin. You break the skin, bad bacteria starts to be able to grow and start to infect, and then it makes it worse, makes it more itchy. So the cycle gets worse and worse. So you break the cycle by stopping the bad bacteria from growing. So this is the good example why you use antibacterial creams, right? To allow the body to heal by stopping the bad bacteria from growing there. So that's how AD Pro works. So it does work for diaper rash. It does work for pimples, even though when we design the product and market the product, we're actually designing it for eczema, psoriasis. So Doc, would this actually apply to hemorrhoids?
I don't know.
Okay. Yeah, I tell you what I use.
don't know.
I also don't know. It's a very interesting question, but I tell you what I use it for, right? I use it for sports chafing. When you wear underwear or when you go running, right? And your shorts start to rub, so your thigh area, sometimes it will get a rash will break out, right? And then it will get very itchy and sometimes painful, like a heat rash in your groin area because of running, right? Because friction of your running shorts. So I used to just have to bear with it, go through that process. So one day I had AD Pro in my house. I said, hey, before the heat rash or the rash sets in, what if I apply AD Pro? So it actually worked. So it calmed down. So there wasn't any inflammation. There was no growth or bad bacteria. And I think this is very applicable if you understand for women as well, right? For their private part area, when there is bad bacteria, there's smell and everything. So actually the inventor of AD Pro actually had another product for women, where it was we of course we didn't pick that up, but she actually had a product for women where when you're having your menstruation, some women, the menstruations when the menstruation cycle set in, the smell is actually not good. The smell is actually not good. So that has got to do with what type of bacteria is happening down there as well, right? So she actually had a product that was good bacteria, and it crowd out the bacteria that causes the bad smelling bacteria, right? So that was another way it worked out. So again, I don't know how to answer this hemorrhoid one. Maybe give me next week. I will go and look at the mechanism of hemorrhoids and my instinctive thing is no lung, because hemorrhoid is not like a rash or anything. Yeah, it's really like a growth, right? Yeah. So I'm sorry, this is as best as we can go to answer your question. We don't really know, so give us some time. I'll go and look it up. Yeah.
Another interesting question also for AD Pro coming from Miss Juvie Miranda. Can AD Pro help with burn marks?
burn marks. I think it can help with burns. Whether it will remove the scarring or not, I don't think it removes the scarring, right? But if it helps the inflammation to die down, then you will resist scratching, and maybe that will, if you don't scratch, you don't reduce the scarring. Very important thing to tell you, although 80 Pro is safe, right? We generally don't recommend that you apply 80 Pro onto the open wound. Okay? We don't recommend that but you can put it at the edge of the open wound. So if a little bit goes onto the open wound, it's perfectly fine. It is actually safe. Yeah. But it's not a product designed to be put on an open wound, right? But it's a design to put on skin that is broken, but not open wound, to crowd out the bad bacteria that causes infection, which causes your redness and everything. So yeah, if you have burn wounds, yeah, it can help by putting on at the edge so that the infection doesn't spread or cause an itch at the edge. Then you're going to scratch the edge, then that part gets more broken, and then the infection, yeah, it's a cycle in itself. But it's not meant to apply onto the open burn wounds. I think there are special products for that.
Really? Okay, going back to PPAR's question, can PPARs help with systemic lupus, SLE? Already DNA and ANA negative last year.
Okay, I can tell you, when I first started, this was a concern because, lupus is your immune system attacking your own organs, right? So I was from many years ago, 10 years ago, when we were looking at this, we didn't have a lot of experience with this. Then we were afraid that, if you strengthen the immune system, will it attack the organs even more? Right? So that was anything that strengthens the immune system was actually, maybe it's a double-edged sword for someone with lupus. So that was originally our concern. But today, our understanding is very different, right? So the PPARs actually helps to modulate your immune response. It helps to regulate your immune response. So our experience with lupus patients is actually very helpful, very useful, and quite effective, all right, in managing for lupus patients. So in Philippines, we don't have so many cases because in Philippines, many of our focus, like our education, this program, you'll notice is a lot about cancer. So it ends up we get a lot more cancer patients than other types of patients. But personally, I've had lupus patients from the Philippines. One of them is actually a food blogger. So you can imagine, actually a food blogger is a bad occupation for a lupus patient. Because if you try different foods, you can trigger and you make your lupus symptoms even worse. You can trigger your lupus, right? Because she was a chronic lupus patient. So her lupus comes and go, right? Yeah, over many years. So what happened was that when she took soft gel capsules, so she was an influencer, we supplied her with 1 month of soft gel capsule. I believe she continued for more than half a year, right? Why? To our surprise, she was actually taking it for weight management, that kind of general thing. I don't think she even told us she had lupus until our second or third meeting but she was very happy because she shared with us all her symptoms for lupus was managed and it didn't come back. And so she was very happy because as a food blogger, she went to take things that would normally trigger potential lupus symptoms, and it didn't. Right. And then later, because of her, when I talked to our factory and our research in Taiwan, then I found out that in Taiwan, there are many lupus patients that use this as a supplement to help them manage their condition and improve their condition. Is this a treatment or cure? We wouldn't go so far because I think you just also need to follow the protocols the doctor prescribes. But in terms of what can you take naturally, this is a product that has proven to have positive effects. So it varies from patient to patient. So it's something that you can take with a certain amount of confidence, not needing to be afraid, right? And then, yeah, I would suggest the soft gel capsules, right? Because that's also our experience with the patient. I don't think, even in Taiwan, most of our patients, they are either they're taking the soft gel capsules or the tablets. No one is actually I haven't heard. I'll check again. My next trip to Taiwan later this month, if anybody actually takes the liquid extracts. Yeah. So for lupus, it's a chronic thing. We take something that a patient can take a long time because financially it must also be sustainable, right? You can't take a super expensive product for years. That's not sustainable. So the tablets and the soft gel capsules are very affordable. So for chronic illness, affordability is actually a very important aspect. Now, of course, if you have an acute case of a reaction, for example, you have eczema or psoriasis, right? And then you took something that really triggered terrible psoriasis reaction, right? Pain and breakout that is very serious. Yeah, that kind of situation, you might take the liquid, right? Just so that you can have the strongest effect, calm your system down. But in general, anything that's chronic, we go for something that is financially sustainable. Doc.
Yeah. For this one, autoimmune. Yeah, so you have to modulate the immune system, lower
Yep.
inflammation. So
Oh.
Simply Nature
Oh, no.
PPARs is something that you can consider. But you have to be careful in that you have to still understand that Simply Nature still has some immune stimulation. So we have to test the waters first for this one. But since
Yeah, so
your DNA, ANA are negative
Yeah.
already, so this is something that we can jump immediately on. Just get a measure of the inflammatory markers you have.
Yeah, which is why I think soft gel capsule is also a good thing. It's strong enough to have a positive effect, but not so strong that you need to actually worry that you are in that minority where your immune system may get stimulated. Yeah.
All right, we're almost at the end of tonight's session. This will be our last two questions for the evening. First one coming from Jake. I would like to ask if liver cirrhosis is curable.
No. You live with it,
Oh.
but it's not something that's curable. So liver cirrhosis is the medical term wherein you have liver scarring. So you have okay, so I'll use the skin as an example. So you have a cut, so that cut will turn into a scab. So imagine your liver having that scab, but the scab for the skin, it peels away because your skin renews itself. But for the liver, it doesn't go away elsewhere. Okay, because the liver itself becomes scarred. So think of this like a huge keloid or a huge scar on your skin that you live with. So it's not something that's curable. That's liver cirrhosis. It's irreversible. Okay, literally when you look under the microscope, it's all scars. There's no healthy liver tissue already for a liver that is cirrhotic.
So doc, I'm just curious if liver cirrhosis is often developed like not in any isolated part of the liver. When it happens across the liver. Is it? Because I was wondering if one part of your liver has already scarred, is it a viable strategy to simply cut it out because the liver is so good at regenerating that if you can isolate, like let's say your left half of the liver is already scarred, right? And can you just cut it out and then allow the left side to regrow again? Or is it because cirrhosis happens across the whole liver that you can't really isolate any part out for surgery? Oh,
Theoretically, you can cut it out. You can. Hello? Yeah, you can cut it out. But sometimes this is not being done because other parts of the liver is already cirrhotic. Okay, so again, it depends on why the liver became cirrhotic in the first place, because there are a lot of reasons why it can become cirrhotic. So if it is hepatitis virus, then no, you cannot cut it out because the entire liver would be affected. But if it is only a small portion, say for example, you develop a liver mass, so you have to cut it out. Okay, a liver tumor or liver cancer, you have to cut it out. Then the rest of the liver would still be healthy enough. Another example would be if you underwent certain procedures that left the liver scarred, so that that scar can be taken out actually. But um, this is in theory, okay? It doesn't happen in real life. Right?
Okay.
It doesn't happen because you don't just take out somebody's liver in the hopes that the liver will regenerate itself. What if it
Mm,
doesn't? What do you say to the
okay.
patient? So
Okay.
you just leave it alone as long as it's not affecting the rest of the liver, then you leave it there. Okay. The
Mm,
only time that you cut something out from the liver is when it is liver cancer. That's the time you cut it out. Yeah, because
mm,
cirrhosis, okay, cirrhosis, um, if a part of the liver becomes cirrhotic, the cirrhosis per se will not affect the rest of the healthy liver tissue. So it's a scar. Okay? It's liver tissue dying. Okay?
mm,
So something else is pushing the liver cells to die, not the scarring per se,
mm,
causing the other parts of the liver to become scarred. Okay?
mm. Okay.
So we leave it alone. We leave it alone. Okay? Yeah.
Okay, for the
Yeah.
last question, coming from Mr.
Yeah.
Carlos. When is the right time to switch my PPARs from powder to capsule? I am diagnosed with diabetes for 5 years.
Oh, Doc, this I would like to hear from you because
Yeah,
uh,
yeah, yeah.
my answer is both will work. It's a matter of speed and finances. Right? If money is not an issue,
Yeah.
then powder until you get the results that you want. If money is an issue, then as long as you move away from serious diabetes, where your condition is less life-threatening, less serious, then you have time. If you have time, you can afford the less expensive one, and take a longer time, but you will still get there. Yeah. Doc.
Okay, so this is coming from my understanding on how the product is manufactured. Okay.
Uh,
So the difference between the powder and the capsule is that the capsule inside has the fatty acids. So when you
mm,
open it, it will literally be oily.
It is slightly oily. Yeah.
Yes, okay. So inside the capsule would be your omega-3 fatty acids, algal fatty acids. Okay, so if you want the omega-3 fatty acids, then you go for the capsule. So this is when you do this when your inflammatory markers are very, very high. Okay, because you want the omega-3s to suppress the inflammation. Now you go for the powder if you want pure PPAR agonist power. Okay, because
Mm,
the powder is it's basically dehydrated. So when you open that, it's powder. I mean, it's dehydrated. That's why it became a powder. Okay. So you use this if you want more higher concentration, or you don't want to swallow things. I mean, powder, it's basically dissolved in your mouth, right? So
yeah.
those are the options. Now, for diabetes per se, when would be the right time to switch PPAR powder to capsule? It's when you
Mm,
go into remission or when you
mm,
get a very good control of your diabetes. So say for
mm,
example, you go into an HbA1c of less than 5.7, then you can go for the capsule. If your inflammation is high, you go for the capsule.
mm.
Okay? Yeah. But if
Okay.
you can afford it with just sheer but if you can afford it, right, with just sheer PPAR agonist, then go for the powder.
Yeah. Yeah. If money is not an issue.
That's my take
So
on it. Okay.
okay, when I make this comment, Doc, when we make this comment, I think some viewers will actually think that wow, only crazy rich Asians will get the powder, and why we say money is not an issue. I want to share with everyone. I am also pleasantly surprised. There are it. When I say money is not an issue, it doesn't mean that you're super rich, right? It means that the way you look at the cost of uh, the treatment is different. So I actually have, for example, cancer patients who come from normal families. the daughter is actually working in Dubai. So they are not like they are tycoons, you know, it's not like they are the Ayalas or something like that, right? It's not that they come from very rich family. So they're just working class but professional. Okay, they're not poor, but they're not super rich, right? So or even rich by any real standards, right? But you know, when I was talking to her and I said, your mom is doing well already, her condition stabilized, she's doing well. You can consider to do the powder extract. I was just thinking for them also financially because they've been on the liquid, I think 2-3 months already. So I was also, you know, I just want to let them know, you know. And then to my surprise, she said, no, my mom is doing well on this. I don't want to change anything, right? So it's what I meant by if money is not an issue is really if your priority is like that. Okay, so I don't mean it by saying that this is only an option that rich people can take. That's not really what I mean. I just mean that if money is not the consideration that limiting, if your first priority is not that, then then it's possible to stay on the powder. Right? Yep.
All right. Looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers, starting with Doc Jansen.
See you on Saturday. See you on
Yeah, I
Saturday. I
wanted to
noticed
say
that
that, Doc.
a lot of people are registering.
Yeah.
I noticed a lot of people are registering and thank you. So I'll see you then. So the QR code, yeah, I allowed them to share it through a QR code, but as much as you download when you arrive on the venue, because I'm going to share some things on the nutrition prescription that I'm going to share with you. Okay, so it would be
Wow.
better if you can see it, but it's okay.
Wow.
You can just listen and then review it when you go home.
I'm
So
so
yeah, see you on
excited.
Saturday.
I'm so excited to hear what Doc is going to share because you know Doc shares new things every time we do SMX, so I'm excited about that. Okay, I think Doc is his internet hang again. All right, for my last words again, same as Doc Jansen. See you on Saturday, right? I'm also preparing new material. So with the help of AI, I'm better able to create slides and use more pictures, right, to help the people understand how PPARs works because it can be a very scientific thing. So if you really want to know how it works, what it can do for you, and present it in a way that's easy to understand, I try to use I'll use many pictures to infographics, right? These are so that you will understand how the product actually works and helps you. So we look forward to that, and of course, I'm looking forward to seeing Dr. Jansen face to face and Dr. Joy as well. So if I'm excited, I can't imagine how you will be excited also if you are patient to have me, Dr. Jansen, Dr. Joy, all there, right? And then you can ask us questions, and it's not like this where you cannot have a follow-up question immediately. And sometimes when you hear other people's dialogue with us, you will get your own answers as well. And of course, for those of you who are a bit more shy, you can come to us after the program, right? So it's not like we run away and disappear immediately after the program. So in fact, it's so hard for Dr. Jansen to leave the room because all the participants start stopping him. Every 2 steps he walks, another person come up to him to ask another question. So we look forward to seeing everyone. I'll hand the time back over to Jen.
Thank you so much to our experts, Doc Jansen Kalalan and Mr. Shyan Lim, for that very insightful and empowering discussion. If you have any follow-up questions, don't worry, we will answer each of them next webinar via direct message or in SMX if we see you there. And we hope to see you again next week for another empowering session, same day, same time, every Thursday night at 7:30 p.m. Pero we'll see you first. Yan, this Saturday, if cancer has touched your life, this is your next step. Remission is not the finish line. The real work is building an internal environment that supports long-term stability. So join us this Saturday for a live in-person seminar featuring a powerhouse panel of cancer experts as we unpack the science of inflammation, metabolism, and sustained recovery. Let's watch this.
Hi everyone, this is Shyan from Simply Nature and I bring you good news. Backed by popular demand, doing our regular SMX event. And the topic for upcoming May 30th event is Beyond Remission, Building a Body that Sustains Recovery. So if you are a cancer patient and you have questions about your diagnosis, what treatments are available and which treatments to take. If you don't know how to combine conventional treatments with natural treatments, then this is the place to be. Because I will be joined by one of the top integrative oncologists in the nation, Dr. Jansen Kalalan. Right, he will be sharing about innovative approaches to supporting cancer. So Dr. Jansen actually specializes in supporting cancer patients undergoing conventional treatment, but he's also an expert in integrative treatment for cancer. And again, like I said, it's a great event for you to ask questions because there will be a live Q&A or Ask Me Anything segment where Dr. Jansen and I will be sitting on stage together and perhaps we will be trying to invite other specialists as well, and you can ask your questions and all of us will be able to be there giving you live answers. This is an opportunity that you cannot miss. So seats are limited, secure them, and feel free to bring a loved one or caregiver with you. All right, so mark it down on your calendar, May 30th. It is a Saturday, 8 a.m. to 11 a.m. at SMX Aura in BGC. See you there.
Yeah, and that is entitled Beyond Remission, Building a Body that Sustains Recovery. That's happening this Saturday, May 13, in the morning, 8 a.m. until 11 a.m. at BGC SM Aura Taguig. Seats are limited, so secure now by talking to your assigned CSO, Client Service Officer, or healthcare specialist. And guys, exclusive promos awaits if you attend on-site. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we are always with you from start to healing.